Hi there. Today we're going to talk about hypertension or high blood pressure. Now this is just going to be a very shallow dive into this subject because we could spend months and months and never hit everything we need to. We're just going to graze the surface today. Hypertension is the most common cause for office visits to a doctor in the United States. That tells us it's a really important topic. Also, about 1/2 of adults who are being treated for hypertension are being treated inadequately. And my philosophy is, if we're going to have you on medicine for something, why not get you to the goal? So we need to tackle this and figure out what we can do besides just taking medicine to help the plan. Blood pressure either contributes to or directly causes a number of other health conditions. It is one of the most common causes of chronic kidney disease. Also increases your likelihood for strokes, heart attacks, among other things. One of the biggest problems I see in my patients who have high blood pressure is that they don't feel anything from it, but it's doing damage if it's high, which is why it's called the silent killer.
The silent killer.
Things that put you at risk for high blood pressure is your age. The older you are, the more likely you are to have it. Family history. If everybody on one side of your family has high blood pressure, that certainly increases your risks. Race is also a strong predictive factor, much higher in those of African American descent. Excessive salt intake, caffeine intake, alcohol use, sedentary lifestyle, among other things, can also contribute. Smoking and obesity are also a couple of really important factors that we can help control. So what sorts of things can we do other than taking the medicines that are prescribed for us that can help bring down our blood pressure? Number one, exercise. Cardio exercise, walking, biking, swimming, something that helps get your heart rate up, can significantly decrease your blood pressure even while you're doing it. As you build up cardiovascular stamina over time, the blood pressure will often come down. If you're a smoker, stop smoking. I'm not here to lecture you about stuff, but stopping smoking can really affect a lot of different disease processes in your body, and I'm sure your doctor will be happy to help you if you need help. If you drink a lot of caffeine, like I do, then certainly cutting down on that can significantly impact your blood pressure. If you eat a lot of salt, that can also be a factor. There's a diet called the DASH diet, which is dietary actions to stop hypertension. This is focusing on decreasing your sodium, eating more fruits and vegetables, especially those that are fresh. If you have anything that is packaged or canned, chances are salt is used as the preservative for that. So focusing on whole grains, fresh fruits, fresh vegetables, and lower fat, higher protein meats can also be very helpful. If you drink alcohol, 2 or more drinks per day is considered problem drinking and is also a significant risk factor for bringing up your blood pressure. So try to keep it to fewer than 7 alcoholic beverages per week. If you can get good, consistent sleep, that also will help your blood pressure. Have a talk with your doctor about things that you can do to help lose weight, because most of those, eating a healthy diet, exercising, or just even getting up and moving your body more, can also have a great impact on your blood pressure. Be cautious about over-the-counter medications because a lot of them can raise blood pressure, things like decongestants especially, but also supplements, certainly those that claim to boost energy or memory levels. Things that have ginkgo or ginseng in them can also have an effect. So most of the time, if I have a patient who has uncontrolled blood pressure and we're trying to get it under control, I'll tell them to stop taking any supplements until we get things under control, and then we may be able to mix those in later down the road, but most people don't need those to begin with. The biggest thing I would tell you if you have hypertension is don't ignore it, because it is doing damage to your kidneys, to your blood vessels, to your brain and your heart, and those are all critical to your long-term health. Don't forget to like and subscribe, and stay tuned for more.